Have you ever brushed off a sudden dizzy spell, a brief moment of blurred vision, or a tingling feeling in your arm because it disappeared just a few minutes later? Many people do. They assume it's just part of getting older, that they stood up too quickly, or that they simply had a tiring day. But what if your body was trying to send you a warning that shouldn't be ignored? One of the most concerning things about a stroke is that it often doesn't arrive without warning. In many cases, the body gives small clues days, weeks, or even months beforehand. The problem is that these warning signs can be so subtle that they're mistaken for everyday problems. Knowing how to recognize them could make all the difference. Because when it comes to stroke, every minute matters. Today we're going to look at 7 silent stroke warning signs that adults over 60 should never ignore. Some may seem surprisingly mild, while others are often blamed on aging. Along the way, we'll also talk about why these symptoms happen, when they deserve immediate medical attention, and what you can do to help lower your risk. Be sure to stay until the end, because the final warning sign is one that many people dismiss as simple tiredness, yet healthcare professionals know it can sometimes point to something much more serious. A stroke happens when blood flow to part of the brain is interrupted. Brain cells depend on a constant supply of oxygen and nutrients carried by the blood. When that supply is blocked or reduced, those cells begin to suffer damage within minutes. That's why quick medical treatment can make such a big difference. Sometimes, before a major stroke occurs, a person experiences what's called a transient ischemic attack, often shortened to TIA. You may also hear it called a mini-stroke. A TIA happens when blood flow to the brain is temporarily reduced but then returns before permanent damage occurs. Even though the symptoms go away, a TIA should never be treated as harmless. It is an emergency because it can be a warning that a larger stroke may happen in the near future. The challenge is that many warning signs don't last very long. Someone may feel completely normal afterward and decide there's no reason to see a doctor. Unfortunately, waiting can mean missing an important opportunity to prevent a more serious event. Let's begin with the first warning sign. Number 1, sudden numbness or weakness on one side of the body. This is one of the most well-known stroke symptoms, but it doesn't always appear dramatically. Instead of complete paralysis, it may begin as a strange heaviness in one arm, mild tingling in one side of the face, or a leg that suddenly doesn't seem to move quite right. Imagine you're carrying groceries into the house. Suddenly your right hand feels clumsy. You struggle to grip the bag, but after a few minutes everything seems normal again. It's easy to blame arthritis, sleeping in an awkward position, or simple fatigue. But when weakness or numbness affects only one side of the body, especially if it comes on suddenly, it's important to take it seriously. Why does this happen? Each side of the brain controls movement and sensation for the opposite side of the body. If blood flow is briefly interrupted in one part of the brain, the affected muscles may not receive normal signals. Even if the weakness disappears quickly, don't assume the problem has passed. Symptoms that come and go can still be a sign that the brain temporarily lost part of its blood supply. If you or someone around you suddenly develops one-sided weakness, facial drooping, or difficulty moving an arm or leg, seek emergency medical care immediately. Do not wait to see whether it improves. And while many people recognize weakness as a warning sign, the next symptom is much easier to overlook because it often lasts only a few minutes. Number 2, sudden trouble speaking or understanding words. Have you ever walked into a room and forgotten why you went there? That happens to everyone from time to time and usually isn't a cause for concern. But imagine knowing exactly what you want to say, yet the words come out slurred or mixed up, or perhaps someone is talking to you, and for a brief moment their words don't seem to make sense, even though you can hear them clearly. This is very different from ordinary forgetfulness. The brain has specialized areas responsible for producing and understanding language. If blood flow is interrupted even briefly, those areas may stop working properly. A person might suddenly use the wrong words, have difficulty finishing a sentence, or seem confused during an otherwise normal conversation. Family members often notice this before the person experiencing it does. Someone may say, "You don't sound like yourself," or "Are you feeling okay?" Those observations shouldn't be ignored. If speech suddenly becomes slurred or confusing, even if it returns to normal after a few minutes, it deserves immediate medical evaluation. Many people assume they'll recognize every stroke warning sign, but the third one can be surprisingly subtle because it affects vision rather than movement. We'll look at that next. Number 3, sudden changes in vision. Our eyesight naturally changes with age. Reading glasses become stronger. Night driving becomes more difficult. Bright lights create more glare than they once did. Those gradual changes are common. What isn't normal is a sudden loss of vision, blurred vision, or double vision that appears without warning. Some people describe it as though a curtain briefly covered one eye. Others notice that part of their visual field suddenly disappears or becomes blurry. Because these episodes can be brief, many people assume dust got into their eye or that they simply need a stronger eyeglass prescription. But the eyes and the brain work together. Even when the eyes themselves are healthy, reduced blood flow to the parts of the brain that process vision can temporarily affect what you see. That's why sudden vision changes should never be dismissed as just another part of aging. It's also worth remembering that several eye conditions become more common later in life. Some require urgent treatment, while others develop slowly over time. Either way, sudden changes in vision deserve prompt evaluation by a healthcare professional. Here's something many people don't realize. Sometimes the warning signs of a stroke don't involve pain at all. In fact, some people experience symptoms that are so mild, they continue their normal activities without realizing anything unusual is happening. That brings us to the fourth warning sign, and it's one that many older adults blame on standing up too quickly. Number 4, sudden dizziness, loss of balance, or trouble walking. Everyone has moments when they feel a little unsteady. Maybe you stood up too fast, skipped a meal, or became dehydrated on a hot day. But stroke-related dizziness often feels different. It may come on suddenly and be accompanied by difficulty walking in a straight line, unexplained stumbling, or a feeling that the room is spinning without an obvious reason. Imagine getting out of bed in the morning, you take a few steps and suddenly feel as though you're being pulled to one side, you grab the wall to steady yourself. A few minutes later, the sensation disappears. That experience should never be brushed aside simply because it improved. The back part of the brain helps control balance, coordination, and movement. If blood flow to this area is disrupted, even briefly, balance can suddenly become unreliable. Of course, dizziness has many possible causes, including inner ear problems, medication side effects, dehydration, and low blood pressure. That's why it's important not to jump to conclusions. However, sudden dizziness combined with other symptoms such as weakness, vision changes, difficulty speaking, or severe headache requires emergency medical attention. Recognizing patterns rather than isolated symptoms is often the key. And next, we'll discuss a warning sign that many people mistake for an ordinary headache, even though the timing and intensity make it very different. A headache is something most of us have experienced at one time or another. It may come after a stressful day, poor sleep, dehydration, or even spending too much time looking at a screen. Most headaches improve with rest, fluids, or the treatment recommended by your healthcare provider, but there is one type of headache that should never be ignored. Number 5, a sudden severe headache unlike your usual headaches. Many people describe this as the worst headache they've ever felt. It may appear suddenly, reaching its full intensity within seconds or minutes. Others notice that it comes with nausea, vomiting, dizziness, confusion, or changes in vision. Not every severe headache is caused by a stroke. Migraines and other conditions can also cause intense pain. However, a sudden, unusually severe headache, especially when it is different from your normal headaches or appears along with other stroke symptoms, needs immediate medical attention. One reason is that some strokes are caused by bleeding in the brain rather than a blocked blood vessel. This type of stroke is called a hemorrhagic stroke. While it is less common than an ischemic stroke, which happens when blood flow is blocked, it is a medical emergency that requires immediate treatment. The important message is simple. If a headache feels dramatically different from anything you've experienced before, don't try to sleep it off or wait until the next day. Getting evaluated right away could save your life. Now let's move to a warning sign that many older adults dismiss because they assume it's simply part of getting older. Number 6. Sudden confusion or trouble thinking clearly. We all have moments when we lose our train of thought or forget where we placed our keys. Occasional forgetfulness becomes more common with age and is not necessarily a sign of a serious problem. But sudden confusion is different. Imagine you're balancing your checkbook, reading the newspaper, or following a favorite recipe. Suddenly, something that normally feels easy becomes strangely difficult. You can't follow simple instructions, you lose track of what you're doing, or familiar tasks suddenly seem confusing. Family members often notice this first. They may see someone repeating the same question several times, struggling to understand a simple conversation, or appearing unusually confused despite feeling well just moments before. This kind of sudden change should never be dismissed as just getting older. The brain depends on a steady supply of oxygen-rich blood to think clearly. If blood flow is interrupted, even for a short time, thinking, memory, attention, and decision-making can all be affected. Of course, confusion has many possible causes. Low blood sugar, infections, dehydration, medication side effects, and other medical conditions can all affect thinking. That's exactly why sudden confusion deserves prompt medical evaluation. Trying to guess the cause at home could delay treatment if a stroke is responsible. By now, you may have noticed something important. Many of these warning signs can disappear quickly. That's one reason strokes can be so dangerous. People often feel better and convince themselves that everything is fine, but temporary improvement does not always mean the danger has passed. In fact, healthcare professionals often emphasize that a transient ischemic attack or mini-stroke should be treated as an emergency because it may signal a much higher risk of a full stroke in the hours or days ahead. That brings us to our final warning sign, one that surprises many people because it doesn't seem dramatic at all. Number 7. Sudden, unusual fatigue or extreme weakness. Everyone gets tired. Busy days, poor sleep, stress, and illness can all leave us feeling worn out, but some people experience an overwhelming sense of exhaustion shortly before or during a stroke. This isn't the normal tired feeling that improves after a nap. Instead, it may feel as though all of your energy has suddenly disappeared. You might wake up feeling unusually drained, struggle to finish routine activities, or feel too weak to do things that are normally easy. On its own, fatigue is not a reliable sign of a stroke because it has many possible causes, including anemia, thyroid problems, heart disease, poor sleep, depression, certain medications, and many other conditions. However, when sudden, unexplained fatigue appears together with symptoms such as weakness on one side, trouble speaking, vision changes, dizziness, or confusion, it becomes much more concerning. The key is not to focus on a single symptom in isolation but to look at the whole picture. So what should you do if you think you or someone else may be having a stroke? The first and most important step is to call your local emergency medical services immediately. Do not drive yourself if you have symptoms, and do not wait to see whether they improve. Many stroke treatments work best when they are given as quickly as possible. Every minute matters because brain cells can be damaged when they go too long without enough oxygen. A helpful way to remember the most common stroke symptoms is the word FAST. F stands for face. Ask the person to smile. Does one side of the face droop? A stands for arms. Ask them to raise both arms. Does one arm drift downward or feel weak? S stands for speech. Is their speech slurred, unusual, or difficult to understand? T stands for time. If any of these signs are present, it's time to call emergency services immediately. Even if the symptoms disappear after a few minutes, don't assume the danger is over. A healthcare professional needs to determine what caused the episode and whether treatment is needed to help reduce the risk of a future stroke. Although not every stroke can be prevented, there are many steps that can help lower your risk over time. Keeping blood pressure within the target range recommended by your healthcare provider is one of the most effective ways to reduce stroke risk. High blood pressure often causes no symptoms, which is why it is sometimes called a silent condition. Managing diabetes, cholesterol, and heart conditions such as atrial fibrillation can also make an important difference. Taking medications exactly as prescribed and attending regular medical checkups allows problems to be identified before they become more serious. Physical activity is another powerful tool. Even moderate exercise, such as regular walking if your healthcare provider says it's appropriate for you, supports heart and blood vessel health. It can also help improve balance, strength, and overall well-being. Eating a balanced diet rich in vegetables, fruits, whole grains, beans, healthy fats, and lean sources of protein supports healthy blood vessels. Limiting foods high in sodium, added sugars, and unhealthy fats may also help reduce cardiovascular risk. If you smoke, quitting is one of the best things you can do for your brain, heart, and overall health. If you drink alcohol, following your healthcare provider's advice on moderation is also important. Good sleep, managing stress, and staying socially connected all contribute to healthy aging. While these habits cannot guarantee that a stroke will never occur, they are part of an overall lifestyle that supports better long-term health. Let's quickly review the 7 warning signs we covered today. Sudden numbness or weakness on one side of the body, trouble speaking or understanding words, sudden changes in vision, unexpected dizziness, loss of balance, or difficulty walking, a severe headache that is very different from your usual headaches, sudden confusion or trouble thinking clearly, and unusual fatigue or weakness, especially when it occurs alongside other stroke symptoms. Remember, these symptoms don't always mean a stroke is happening. Many other conditions can cause similar problems. But because a stroke is a medical emergency, it's always safer to have sudden or unexplained symptoms. Evaluated promptly rather than hoping they'll go away on their own. The goal isn't to create fear. It's to help you recognize important warning signs early, when treatment may have the greatest chance of helping. Healthy aging isn't about trying to predict every health problem. It's about learning to listen to your body, staying informed, and taking action when something doesn't seem right. Thank you for spending this time with us today. We hope this information helps you feel more prepared and confident about recognizing stroke warning signs. For yourself or someone you care about, now we'd love to hear from you. Which of these 7 warning signs surprised you the most? Have you or someone close to you ever experienced a transient ischemic attack or a stroke, and what did you learn from that experience? If you're comfortable sharing, let us know your age and the country you're watching from. It's always encouraging to see people from around the world coming together to support one another in living healthier, more independent lives. Take good care of yourself, stay informed, and we'll see you in the next video.